morning, everyone. I'm here to present a case series of retinitis pigmentosa with ocular and systemic associations. Firstly, retinitis pigmentosa is a group of hereditary disorders of the photoreceptors and retinal pigment epithelium, which gradually cause night blindness and progressive constriction of the visual fields. Waxy pallor of the optic disc and arteriolar narrowing are found in almost all of the cases. Pigmentary changes are usually seen, but may be absent or mild early in the course of the disease. The pigmentary changes seen are characteristic of bony spicules, diffuse granularity or stippling, and pigment clumping. These are due to photoreceptors degeneration, atrophy in the outer retina and pigment epithelium, and RPE cells migrating into the retina. The photoreceptor and RPE function loss progresses posteriorly and can lead to loss of visual acuity from involvement of the macula and constriction of the visual field. It can be found in isolation where it is referred to as non-syndromic RP, or in association with a variety of systemic diseases where it's referred to as syndromic RP. My aim of the study was to study the various manifestations of retinitis pigmentosa and to study the various ocular and systemic associations of retinitis pigmentosa. This is basically a case series of 18 cases of retinitis pigmentosa. Institutional Ethics Committee approval was obtained. This study was conducted over a period of 1 year. A brief history was obtained, which was followed by visual acuity assessment, complete ocular examination, direct and indirect ophthalmoscopic examination, fundus photography, evaluation of various systemic associations, and other specialty evaluations were advised when required. Coming to the results, most of the cases were in the age group of 15 to 30 years, while 5 cases were less than 15 years and 3 were more than 30 years. And there were 13 males and 5 females. Most of the cases had a vision better than 660, 11 cases, while 7 of them had a vision less than 660. The most common anterior segment finding that I found was posterior subcapsular cataract, and 4 of them were already operated, so pseudophakic patients, and 5 were normal patients, while 1 we found keratoconus. And coming to the posterior segment findings, we found pigmentary bony spicules in all the 18 cases. In 14 of them, the pigmentary spicules were present involving the mid-periphery and beyond, while in 4 of them there was central and patchy distribution. Consecutive optic atrophy was present in 8 patients, maculopathy in 6, cystoid macular edema in 1 patient, myopic changes in 5, glaucomatous changes in 2, and in 1 patient we saw that there was coloboma. This is a bar representing the same. The top images are showing a typical retinitis pigmentosa associated with maculopathy. The bottom images are also showing retinitis pigmentosa. These images are showing atypical retinitis pigmentosa. Here we can see some tessellations and pigment distribution. This is an OCT that is showing CME that we found in 1 patient. And the most common systemic association that we found was sensorineural hearing loss in 4 patients, heart block in 1 patient, polydactyly and truncal obesity in 1 patient, and alopecia was present incidentally in 1 patient. This is a bar representing the same. Retinitis pigmentosa refers to a group of hereditary retinopathies that result in progressive vision loss. Prevalence of RP is around 1 to 3,000 to 5,000. In this study, we have come across 18 cases of retinitis pigmentosa, of which around 80% of them had ocular associations, while only 40% of them had systemic associations. Natarajan et al. Has reported that around 50% of patients develop posterior subcapsular cataract, cause of which has been subjected to be low-grade ocular inflammation. In this study, we have found posterior subcapsular cataract in 45% of the patients, and 20% of them have already been operated. Natarajan et al. Has also reported that there is a higher prevalence of myopia and astigmatism in RP patients. In this study, we have noted myopic changes in 25% of the patients. Joanne D. Arias et al. Reported prevalence of macular edema in RP to be around 8 to 50%, cause of which has been hypothesized to be breakdown of blood-retinal barrier. In this study, we have found macular edema in 5% of the patients. Other ocular associations that we noted were keratoconus and glaucomatous changes. In a study done by R.P. Mills and D.M. Calver on 17 patients, they found 6 patients of Usher syndrome. In this study, we have noted sensorineural hearing loss in 4 patients. Other systemic associations that we found were polydactyly and truncal obesity in 1 patient and heart block in 1 patient. Coming to my conclusion, in conclusion, our study confirms the retinal associations in the previous studies and also adds to the existing literature. Patients of RP present with nyctalopia and progressive constriction of the visual fields. Visual acuity is usually affected late but can be affected early due to PSCC, cystoid macular edema, and foveal atrophy. ERG becomes abnormal very early in the disease and hence aids in the diagnosis. Perimetry, fluorescent angiography, and OCT are advised when necessary. Low vision aids are useful to these patients. Gene therapy, stem cell therapy, and retinal implants are the other treatment modalities available. Thank you.